Our final speaker in this session will be Brian Elbel of the New York University Langone Health System, presenting about COVID-19 vaccinations and school community resources, children's longitudinal health and education outcomes using linked administrative data. Brian, the floor is yours.
So let me start with just introducing a little bit of myself and my team. As you heard, I'm Brian Elbel at NYU, and joining me is my co-PI in this work, Amy Ellen Schwartz, who just started a new gig as dean at the Biden School at the University of Delaware. And we have collaborators from NYU, from Syracuse, and also really importantly, perfect. Thank you so much, Megan. You can just go to the next slide. From the New York City Department of Health and Mental Hygiene, which is sort of really important for our work here. And that's Kevin Conti and Sophia Day as well. So the next slide gives you a broad set of our aims. And if you wouldn't mind going there, Megan. And the first one really looks at, with the focus on disparities, looking at kind of really the health and education changes of children in the post-pandemic period. And you know, the basic idea here is we're going to use a new data set, sort of similar to what Michael did, and I'll describe it in a second, to really say, you know, how are kids in New York City public school system faring broadly as a result of the pandemic, and how does what's the influence of how does disparities impact there? The second is how does vaccination change that, either at the individual kid level, the school level, the neighborhood level. And then the third point is really looking at what about resources that we know are available in the neighborhood or the school? How does that kind of change the overall trajectory as well? So the next slide, please, is really focused on kind of describing the data, right? And this is a new data set called the New York City Student Population Health Registry. Basically, you can think of this as the New York City public school kids as the base of students, and then that's largely the universe of kids that we have data on. And then from that, we link a whole bunch of stuff from not just the education record, but from health records available as well, largely through the city health department. So, and this is sort of one of the first times we've been able to kind of look at such a large cohort of kids in a comprehensive, longitudinal way across multiple domains. This is something that Amy and I have been working for a long time with the city to kind of help put together, and COVID was a nice motivating force for it. Just to give you a sense of the New York City public school system, which actually started today, I dropped my daughter off at middle school this morning, it's about at least pre-COVID, it was about a little over 1 million kids a year. About 85-ish, 86% of kids within New York City attend public schools, 2/3 Black or Hispanic, about 75-ish% from low-income households. So the next slide just gives you a little bit of a sense of the type of data that are in SBER, is what we call it, the Student Population Health Registry. You know, from the demographics, we have everything, including up to and including name in a very kind of protected way. Language spoken at home, race, ethnicity, home address, how does home address sort of how it's changed over time, the school attended, a whole bunch of ID numbers that we can link to other things. Including the next slide, the next sort of middle orange area, a whole bunch of data in the health and in the education domain. One of them there being the kind of citywide immunization registry. Every immunization given in New York City that's reported to the city health department, we link up to the data. We have Medicaid claims. About 75% of kids are in Medicaid. Sparks, which is basically every ED and outpatient claim within the state, not limited to Medicaid. And then a whole bunch of stuff from the education record, right? You know, including things like attendance and did they graduate and what are their grades and test scores and behavioral problems. Something called a fitnessgram, which is a height and weight measurement that the city has done every year, as well as some fitness measurements going back to kind of 2006-07. Test scores, which are just kind of ramping back up again. And then a bunch of kind of site level stuff at the school, right? What grades do they serve? Do they have a permanent school nurse? Do they have a school-based health clinic? What sort of, are they something we call a community school here in New York? I mean, I think this just kind of gives you a sense of the scale and scope and broad flavor of this sort of work. So the next slide is just an example of two different projects that we've started working on. This first one actually is embargoed as well. It's coming out in JAMA Network Open next week. When we were waiting for our data access to get going, we sort of said, let's start with looking at, which we're fully up to speed now, let's start with looking at school level data, right? So we sort of pulled at least kind of the school level data and sort of said, let's look at kids greater than or equal to 5. Let's look at their vaccination status. Again, a school level variable here linked with school level demographics and things like that. And basically what we're going to do is we're going to say the school system in New York City is still quite segregated. And we're going to say, like, let's look at the majority population of each school by race and ethnicity, and basically say, like, how does that race and ethnicity of the school relate to the vaccination rate of the school? So the next slide gives you a little bit of a flavor of the type of work we can do with something like this. So you can sort of see that over on the right there, about 11% of schools in New York City are majority Asian, 12.7 majority Black, down to about a third of schools which are not in any majority. They have a diverse enough racial group. And to the left, it gives you the vaccination rates in the fully vaccinated rates for about the 1,600 New York City public schools. And you can see there that for majority Asian schools, you have about 65% of the kids vaccinated. For majority Black and Hispanic schools, you're down to about 45%, a little more. You can also see the breakdown for elementary versus middle schools or above. That break's important because it's around the 12-year mark where different timing happened for vaccination. And then importantly as well, you also see pretty big differences by borough of New York, right? Where Staten Island is the lowest with about 38% of the average vaccination rate of schools in Staten Island are about 38%, just close to 60% for Manhattan. The next slide does a little bit more breakdown here by race and ethnicity of the school by borough, and this is where it kind of becomes more interesting here. If you look at something like the lighter blue line for Asian majority Asian schools, you see that they're consistently the highest, upwards of 60%. And you see things like, if you look at the kind of the bottom line, the white line there by borough, you see that down at the bottom, Staten Island there, only about 25% of kids in majority white schools in Staten Island are vaccinated, where in Manhattan, a majority white schools in Manhattan, over 60% of students are vaccinated. Right, so that kind of gives you some of the differences, not just by race and ethnicity, but also really by geography as well. So the last thing I'm going to show you is some work using actually the student level data, right? And so if you can go to the next slide, Megan, actually 2 slides from now, perfect. So basically, we're sort of taking our citywide immunization registry that's linked up with the SBE data, and we're just going to look at the kids who are 5 to 18. And we do have data on fully or partially vaccinated. We're not looking at boosters today. We're just looking kind of fully or vaccinated. And what we're going to say for the purposes of the data I'm going to show you today is fully vaccinated, you got 2 immunizations. We're going to look at a consistent 180-day period after your age group became eligible, just to make it a little more apples to apples across these age groups. And I'm going to show you a very simple OLS that just basically focuses on what are differences, to some extent by sex, but largely by race and ethnicity. A couple very basic controls for Medicaid status. Are they enrolled in Medicaid, or have they historically been enrolled in Medicaid? And then I'm also going to do some work on taking in and out neighborhood or school level fixed effects, just to see to the extent to which this is driven by the neighborhood you live in or the school you go to. So the next slide just gives you a sense of our data, right? And how kind of detailed and granular they really are here. The first yellow line on the left, the dotted line on the left, is when 16 plus became eligible for vaccination. The next blue line is dotted line is 12 to 15. And then the right one is when 5 to 11 become vaccinated. And then these are sort of how you see vaccination increasing. We have these data by the day. You see that basically, no kids were getting vaccinated before they became eligible, and they started getting them at the rate where they became eligible. The 5 to 11 group became eligible later and kind of topped out a little bit later, a little bit lower in terms of the proportion of kids that are vaccinated. So that just kind of gives you a sense of the data, if you will. The next slide is just a little bit more about the demographics on the individual level. Slightly more male than female. Majority Hispanic. The largest racial ethnic group is Hispanic, then Black, then white, then Asian, then white in New York City. And that's the age breakdown, mirroring the age breakdowns I just showed you as well. The next slide is results from a very simple OLS, controlling for age basically consistently, and then kind of taking in and out school or neighborhood fixed effects. This is the predicted probability of being fully vaccinated at that 180-day mark there. And you see that actually females are slightly more likely to be vaccinated, anywhere from around 51.3% in the final model to 50.4. So, around a 1 percentage point difference. You see very similar results actually than what you saw in the school level results, where Asian students are the most likely to be vaccinated. In sort of Blacks or white populations, students are the least likely to be vaccinated. Not a whole lot of difference here. Some differences taking kind of in and out of school versus neighborhood fixed effects there. So you see some differences, but not sort of a crazy differences there overall. So that doesn't appear to be kind of the biggest driver, at least for these kind of, this is zip code is the neighborhood level we're using here. The next slide looks at some of the differences again by borough. And here you start seeing kind of different sort of geographic differences at a broader geographic level. You start seeing a couple different things, right? One is similar to what we saw before, where white students in Staten Island or in the Bronx have a much lower vaccination rate than white students in Manhattan at about 69.7% versus 29.8% in Staten Island. Asian students consistently have the highest likelihood of being vaccinated, although it still varies, right, from 66% in the Bronx and 84% in Manhattan. And obviously, Asian groups are not all the same, and there's lots of sort of differences that we're not able to see and observe by looking at variables like this. So this just gives you a flavor of the kind of work we're going to be able to do, we think, with this stuff. And the next slide just breaks down a few more kind of teaser questions of things that we're looking at. We're starting to do some work on mental health, including, unfortunately, things like suicide or attempted suicide. We're going to try to look at, how does this vaccination work for various education outcomes like attendance, enrollment, changes in enrollment in special education, changes in special education. Some of this is going to be descriptive, although we think we have some methods given kind of which schools had school-based vaccination clinics, et cetera, where we can kind of tease out maybe something a little less endogenous than just kind of looking at receipt of vaccination. What about well child visits, right? What about kind of chronic conditions like asthma and diabetes? How do those things impact here over time? And then a bunch of these school level variables that we have access to as well. How does that impact some of the school level or individual level vaccination rates? And really just looking at these overall trajectories kind of from a health and education perspective, and including how vaccination impacts those things. So that is our work, and we're happy to be part of this group and happy to answer, Amy and I are happy to answer any questions as part of the Q&A.